Finally, there is health insurance available in Michigan for people with pre-existing conditions. Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Our topic today is HIP Michigan. Here to discuss it with us is its Chief Administrator and also the President and CEO of Physicians Health Plan of Mid-Michigan, Scott Wilkerson. Thank you so much for joining us today.
Thanks for having me.
What exactly is HIP Michigan?
HIP Michigan is a program that provides health insurance to individuals that have significant pre-existing medical conditions that are otherwise unable to find health insurance.
This is a federal program, a state program. How exactly does it work?
It is a federal program. It's part of last year's health reform legislation known as PPACA, and it's a program that got up and running late last fall.
So in October, you sort of took your first enrollees, and have you had a lot of people so far take advantage of the program?
Right. The program did start October 1st of last year. We were awarded the contract in August. We got the program up and running. At this point, we do have people enrolled. It's a program that's potentially eligible to have about 3,500 people in the program when it's fully up and running.
So not a huge number of enrollees. So who should be perhaps thinking about enrolling or at least finding out if this might be for them? Who would be your ideal candidates?
Well, first of all, you've got to have some type of pre-existing medical condition that's like cancer, diabetes, sickle cell anemia, Alzheimer's. There's a full list out on our internet site of conditions that would typically be covered. So you've got to be someone in that bucket, so to speak. You've got to have not had health insurance for the last 6 months. You have to be a U.S. citizen or a U.S. national, and you have to be a Michigan resident as well.
And then if you were to qualify and be accepted and have this insurance, what types of premiums would you pay, and then what would be covered?
The program does provide for fairly reasonable premiums. They range from just under $200 to just over $650 depending on your age. The health insurance that offered is the type of coverage that you would normally get through some type of group insurance through your employer, and the coverage is the same type of coverage that you would get through your employer historically. And the neat thing about the program is that the pre-existing condition itself is covered, all the medications, all the services tied to that pre-existing medical condition.
So a decent policy that's going to cover your prescription drugs with some sort of maybe $10, $15 copay, office visits with some sort of a reasonable $10, $20 copay, that type of thing?
Absolutely. Copays range from $20 to $30. On the medication side, they range from $10 for generics to $30 to $50 for brand medications. There are deductibles for medical services, but these types of healthcare services can cost $25,000 to $200,000 a year or more for people with significant health conditions. So this is a huge financial advantage to people that have these conditions, and not only the financial side of the equation, they're really guaranteed access to the system, with which many of these people aren't today. We did have one person who signed up that was diagnosed with cancer 6 months ago, and they were not able to get the services they need until this program became available. So this is a huge difference maker.
And then who might accept or not accept this coverage? All Michigan hospitals, doctors' offices, do they have an option to accept or reject? Do most accept it?
We have a network of providers. You can find out more specifically, but we have more specifically find out on our internet site. The list of providers is long. Across the state of Michigan, we've got hospitals and doctors in every county across the state. So it is a full list. We think that people are going to be able to find the doctors and hospitals they need.
Wonderful. What a wonderful thing for folks, certainly with pre-existing conditions who've known for a long time. Sometimes you can't get any coverage at all, even if you're willing to pay. Thanks so much for joining us today.
Thank you.
For more information on today's topic, you can head to hipmichigan.com or call 877-459-3113. Today's Comcast Newsmaker was Scott Wilkerson, the Chief Administrator of HIP Michigan.